Heart disease. Cardiovascular disease, also called heart disease, is a family of diseases characterized by dysfunction of the heart and blood vessels. It includes diseases such as atherosclerosis, arteriosclerosis, stroke, and hypertension. Heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 37 seconds in the US from cardiovascular disease. And about 647,000 Americans die from heart disease each year. That's 1 in every 4 deaths. Arteriosclerosis is a generic term for several diseases in which the arterial walls thicken, harden, lose elasticity, and calcify. It results in decreased blood supply, especially to the brain and lower extremities. It commonly shows its effect first in the legs and feet, and arteriosclerosis generally leads to hypertension. Atherosclerosis is a thickening and narrowing of the walls of the medium and large blood vessels due to the buildup of lipids, cholesterol, materials, and other cellular debris. This buildup is called plaque, as you can see here. Plaque narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can stop the blood flow and cause a heart attack or stroke. Atherosclerosis usually occurs with aging and is often associated with obesity, hypertension, and diabetes. Coronary heart disease is the most common type of heart disease and is primarily due to blockage of the arteries caused by atherosclerosis. A heart attack occurs when the blood flow to a part of the heart is blocked by a blood clot. If this clot cuts off the blood flow completely, the part of the heart muscle supplied by that artery begins to die. An ischemic stroke, the most common type, happens when a blood vessel that feeds the brain gets blocked, usually from a blood clot. When the blood supply to a part of the brain is shut off, brain cells will die. High-risk groups for heart disease. Group 1. The risk factors are not preventable for Group 1. Males 45 and older, females 55 and older, premature menopause without estrogen therapy, family history of heart attack or sudden death before 55 in males and 65 in females. Android or central obesity, that's obesity that's primarily settled around the gut. Type A personality. And before menopause, women have a lower risk for heart disease than men due to lower levels of high-density lipoproteins or HDLs. However, after menopause, the drop in estrogen increases the risk for heart disease due to lower HDLs. Group 2, comorbidities. This means that another disease exists along with heart disease. Hyperlipidemia, hypertension, obesity, diabetes, gout, which is a buildup of uric acid. We also have a third group, and this is where lifestyle factors increase the risk. And this is where public health, nutrition education can make a difference. Dietary factors, particularly high intake of calories, total fat, saturated fat, and cholesterol, overweight and obesity, sedentary lifestyle, cigarette smoking. LDLs greater than or equal to 160 milligrams per deciliter, HDLs less than or equal to 40 milligrams per deciliter, triglycerides more than or equal to 250 milligrams per deciliter, hypertension, now defined as more than 120 over 80, or I should say 120 over 80 or higher, excessive caffeine intake, stress, and excessive alcohol intake. Please note that the biomedical lifestyle risk factors just discussed will vary by age, sex, family history, other comorbidities, and other factors. Physician will make lifestyle and clinical recommendations accordingly. Alcohol and heart disease. Alcoholic beverages may have some health advantages, but they do not have enough to justify drinking slowly for health. And most of the studies about alcohol and heart disease have looked at red wine in particular. Alcohol or ethanol raises HDL and tissue plasminogen activator, an enzyme responsible for dissolving blood clots. Moderate intake raises HDL cholesterol, which may slow down the buildup of plaque. It also makes the platelets less sticky, which prevents blood from clotting. Moderate intake is 1 drink a day for women and 2 drinks a day for men. Again, I want to emphasize that the studies have looked primarily at red wine. And some studies have actually showed that grape juice from the red grapes may actually also have some positive effects. Sugar and heart disease. Now, this is surprising to many people because traditionally we've always talked about fat and heart disease. But what we now know is that some scientific evidence has not been emphasized as much as they could have been. And studies show that a diet high in sugar increases your risk for heart disease. Individuals who consume 25% or more of their calories as added sugar are twice as likely to die of heart disease as those who consume less than 10% of their calories as added sugar. A high sugar diet stimulates the liver to dump more harmful fats, LDLs, into the bloodstream. Some studies also show that a high sugar diet can also raise blood pressure. The American Heart Association recommends no more than 6 teaspoons or 100 calories a day of sugar for most women and no more than 9 teaspoons or 150 calories a day for most men. And to give you an idea of what this may look like, a 20-ounce cola, which you may get in the vending machine, has 16 teaspoons of sugar. Dietary fats and heart disease. Saturated fats are usually considered to be bad fats. They are major contributors to cardiovascular disease. And saturated fats can raise the level of cholesterol in the blood. So what are saturated fats and where do they come from? Well, they are usually solid at room temperature, come primarily from animal origin. However, there are a few plant sources that have saturated fats, and these include coconut oil, palm oil, and palm kernel oil. Polyunsaturated fats. Although much healthier than saturated fat, polyunsaturated fats are considered to be less healthy than monounsaturated fats. Research indicates they may reduce the protective high-density lipoproteins as well as raise the harmful low-density lipoproteins or LDLs. Omega-6 fatty acid, such as linoleic acid, is an essential polyunsaturated fatty acid that is found in unrefined safflower, corn, sesame, and sunflower oils. Omega-3 fatty acids, such as alpha-linoleic acid, is an essential polyunsaturated fatty acid that is found in oily fish, flax oil, soybean oil, pumpkin seeds, walnuts, and dark green vegetables. Also found in olive oil and avocado. Monounsaturated fat is considered to be probably the healthiest type of fat. It has none of the adverse effects associated with saturated fats, trans fats, or omega-6 polyunsaturated vegetable oils. It provides essential fatty acids for healthy skin and the development of body cells. The high consumption of olive oil in Mediterranean countries is considered to be one of the reasons why these countries have low levels of heart disease. Monounsaturated fat is believed to lower cholesterol and may assist in reducing heart disease. Cholesterol. Cholesterol is the major cause of plaque. The liver makes 95% of the body's cholesterol, which means that we need to control the other 5% from diet. And what the science is saying now is that we really should not worry as much as we were told before about dietary intake of cholesterol, not because we should not control our cholesterol intake, but 95% of it is made in the liver. So we can try and control the 5% from fat, but the recommendations that we had previously about eliminating eggs, especially egg yolks, have been revisited. Saturated fats increase total cholesterol. Another reason why we need to look at saturated fats. Triglycerides. These are the types of fat found in food and the body. They are found in the visible fat on chicken and meats. So when you talk about cutting off the fat, you can actually see this is triglycerides primarily. Triglycerides are also produced by the breakdown of certain sugars in the diet. Another reason to control processed sugar. And triglycerides are stored as body fat. If you're consuming too much triglycerides, too much sugar, everything ends up being stored as body fat. Plant sterols, stanol, and esters. Plant sterols are natural substances found in all plant foods that we eat in small amounts every day. These include foods rich in vegetable oils, such as margarines, salad dressings, nuts, and seeds. They're also found in smaller amounts in legumes, breads, cereals, fruit, and veggies. And plant sterols and stanols may reduce total cholesterol and LDL levels. Plant sterols and stanols are similar in structure to cholesterol, but they're not made in the body. And they work by reducing cholesterol absorption from the gut. And 2 to 3 servings of foods with plant sterols each day, in place of similar foods, may lower LDL cholesterol and may reduce your risk of heart disease. An example of plant sterol would be like the Benecol spread that would normally be found in the butter and margarine section. So these spreads are better options, but they still have calories. Trans fatty acids. Trans fats are synthetic fats that are made from oil bombarded with hydrogen atoms through a process called hydrogenation. They are found in cookies, crackers, and other similar foods. And trans fats raise LDL cholesterol and lower HDL cholesterol. Trans fats must be listed on food labels. And so what we know, because there's a regulation now of trans fatty acids, manufacturers are now not using hydrogenation. And so hopefully in a few years, we will not see a lot of commercial processed foods with any trans fats whatsoever. Lipid transport. Lipids are transported in the bloodstreams packed as lipoproteins. And lipoproteins differ mainly by size, density, and the composition of their lipid cores. The main lipoproteins are chylomicrons, very low density lipoproteins or VLDL, intermediate density lipoproteins or IDL, low density lipoproteins LDL, and high density lipoproteins HDL. And these are discussed in more details in one of your handouts. Therapeutic lifestyle changes. Consume no more than 30% of calories as fat. Eat a diet low in saturated fats and cholesterol. Maintain a healthy weight. Become physically active 5 or more days a week. Quit smoking. Control your hypertension. Control diabetes. As part of an annual exam, have a serum lipid profile done. If you're over age 30, your serum cholesterol should be under 200 milligrams per deciliter. And if you're under age 30, your serum cholesterol should be even lower, under 180 milligrams per deciliter. High risk if cholesterol is more than 240 milligrams per deciliter. Requires intensive dietary modification And if not successful, statin drugs may be added. People at moderate risk, 200 to 240 milligrams per deciliter for their cholesterol, will require intensive dietary modification. Furthermore, triglycerides should be measured because they may not increase the risk of heart disease, but they may increase the risk of diabetes, kidney problems, and other conditions.